Reproductive health has been defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity of the reproductive system. It addresses the reproductive processes, functions, and systems at all stages of life, and includes fertility regulation, safe motherhood, infant and child survival, sexually transmitted disease including HIV and AIDS, and the prevention of unsafe abortion. The World Health Organization (WHO) estimates that reproductive health accounts for about 20% of the global burden of disease. One of the major challenges facing the 15 countries in the West African sub-region is the poor state of reproductive health in the region. With high rates of fertility, maternal mortality, and unsafe abortion in the region, coupled with some of the lowest rates of contraceptive prevalence, which leads to one of the highest population growth rates in the world, West Africa is indeed seriously challenged when it comes to the reproductive health of its citizens. To address this issue, the World Bank recently supported the establishment of a Center of Excellence in Reproductive Health Innovation at the University of Benin.
The Center of Excellence in Reproductive Health Innovation was designed to build capacity within West Africa to address some of the challenges we have with respect to reproductive health. Especially we know that the region has the highest body of maternal mortality, as well as unsafe abortion, and very high rates of fertility and infertility, which have not been adequately addressed by policies and programs. We believe that part of the reason for this is the lack of human resources who are trained and properly nuanced in the principles and practice of reproductive health. There's a deficit of such personnel in West Africa, throughout the West African region.
The center's activities will focus on building the capacity of medical professionals through extensive trainings, workshops, seminars, and other such activities. This center will also pioneer research that will highlight the many reproductive health challenges in the region and recommend possible interventions to stem the tide. Specific objectives of the center includes training of students and technical experts and policymakers through short courses on relevant fertility, maternal mortality, HIV and AIDS, and reproductive health policy topics in the region. Masters in reproductive health, public health, health economics, and nursing. PhDs in reproductive health, public health, and nursing. Develop regional laboratory capacity to support HIV and AIDS and other reproductive health-related problems. Construction has been completed at the permanent site for the Center of Excellence, with state-of-the-art equipment currently being installed. The center will house several laboratories, lecture halls, research spaces, comfortable offices that will facilitate research and collaboration, 24-hour standby electricity and portable water, and other installations that will make it possible for students and staff to work at an optimum level. The center, which has already started accepting students and engaging in different activities, has several outputs planned. These include new master's and PhD programs in reproductive health, public health, nursing, and health economics. Staff and students participating in outreach experience into the private sector and other regional partners. Delivery of short courses on reproductive health-related topics. Formation of regional partnerships to increase regional faculty and students at the center. Increased academic productivity by center student and faculty through academic paper output and research grant applications. The Center of Excellence for Reproductive Health at the University of Benin is ready to begin changing the narrative about reproductive health issues in West Africa. To join us in this innovative work or obtain more information about the center, please visit our website or contact us with the information on the screen.